Interstitial lung disease, or ILD, is an umbrella term used for a large group of diseases that cause scarring or fibrosis of the lungs. The scarring causes stiffness in the lungs, which makes it difficult to breathe and get oxygen to the bloodstream. Lung damage from ILDs is often irreversible and gets worse over time. Symptoms of interstitial lung disease. When you have interstitial lung disease, you can't get enough oxygen into your blood. As a result, you feel short of breath, especially when you exercise or climb stairs. Eventually, you may find it hard to breathe, even at rest. A dry cough is another symptom. Symptoms often get worse over time. See your doctor if you have trouble breathing. After a diagnosis, you can start treatments to manage the inflammation and scarring. Causes of interstitial lung disease. Interstitial lung disease seems to occur when an injury to your lungs triggers an abnormal healing response. Ordinarily, your body generates just the right amount of tissue to repair damage. But in interstitial lung disease, the repair process goes awry and the tissue around the air sacs or the alveoli becomes scarred and thickened. This makes it more difficult for oxygen to pass into your bloodstream. Interstitial lung disease can be triggered by many different things, including airborne toxins in the workplace, drugs, and some types of medical treatments. In most cases, the causes are unknown. Occupational and environmental factors. Long-term exposure to a number of toxins and pollutants can damage your lungs. These may include silica dust, asbestos fibers, grain dust, bird and animal droppings, radiation treatments, indoor hot tubs. Some people who receive radiation therapy for lung and breast cancer show signs of lung damage months or sometimes years after the initial treatment. ILD treatments. Our goal is to improve the overall quality of your life by resolving inflammation and reversing or slowing the rate of ILD progression. Depending on the specific cause and progression of your disease, treatments may include medications, corticosteroids like prednisone, immunosuppressive therapy, immunomodulator therapy, antioxidants, antibody treatment, antifibrotic therapy, and others such as intravenous immunoglobulin treatment, pulmonary rehabilitation, oxygen therapy. Treatment for the comorbidities may be used as needed. Continuous positive airway pressure or CPAP for obstructive sleep apnea, medications for reflux, medications for pulmonary hypertension, surgery. Patients suffering from advanced ILD may also be referred for lung transplantation, palliative or supportive care. What is the best food for interstitial lung disease? People with chronic lung disease may gain weight for many reasons, such as poor diet, medications, and lack of exercise because of shortness of breath. This weight gain can be stopped by following the guidelines below, in addition to those in the general guidelines for healthy eating. Eat a high-protein, low-carbohydrate diet. There is some evidence that this kind of diet may decrease appetite. Eat carbohydrates in the form of fresh fruits and vegetables, not simple carbs. Simple carbohydrates and concentrated sweets, such as cakes, pies, cookies, jams, honey, chips, breads, candy, and other highly processed food, are full of empty calories. Fresh fruits and vegetables are full of important nutrients your body needs. Limit saturated fat and cholesterol. Choose lean meat like poultry and fish. Avoid fried food like food with oil, butter, margarine, and mayonnaise. Eat small, frequent meals. This will help satisfy your appetite and make breathing easier than if you eat large meals. Avoid these foods with lung disease. Cold cuts. Most cured meats such as bacon, cold cuts, ham, and hot dog contain additives called nitrates. Excessive salt. With a small pinch of salt cooked in a dish, it may be fine. But a salt-heavy diet can be a problem. Dairy products, cruciferous vegetables, fried foods, carbonated beverages, acidic food and drinks. Can I heal my lungs naturally? Green tea. Green tea contains many antioxidants that help reduce inflammation in the lungs. These compounds may even protect lung tissue from the harmful effects of smoke inhalation. A recent study involving more than 1,000 adults in Korea reported that people who drank at least 2 cups of green tea per day had better lung function than those who drank none. Steam therapy. Steam therapy or steam inhalation involves inhaling water vapor to open the airways and help lungs drain mucus. People with lung conditions may notice their symptoms worsening in the cold or dry air. This climate can dry out the mucous membranes in the airways and restrict blood flow. Conversely, steam adds warmth and moisture to the air, which may improve breathing and help loosen mucus inside the airways and lungs. Inhaling water vapor can provide immediate relief and help people breathe more easily. Drain mucus from the lungs. Postural drainage involves lying in different positions to use gravity to remove mucus from the lungs. This practice may improve breathing and help treat or prevent lung infections. Postural drainage techniques differ depending on the position. Number 1. On your back. Lie down on the floor or bed. Place pillows under the hips to ensure that chest is lower than the hips. Slowly inhale through the nose and exhale through the mouth. Each exhale should take twice as long as the inhale. This is called the 1:2 breathing. Continue for a few minutes. Number 2. On your side. Lie on one side, resting the head on an arm or pillow. Place pillows under the hips. Practice the 1:2 breathing pattern. Continue for a few minutes. Repeat on the other side. On your stomach. Place a stack of pillows on the floor. Lie down with the stomach over the pillows. Remember to keep the hips above the chest. Fold the arms under the head for support. Practice the 1:2 breathing pattern. Continue for a few minutes. Quit smoking. Not only will it actively take years off from your life, but it will make your disease symptoms significantly worse. And trust, although the symptoms of ILD may not be bad enough for you to change now, by the time they progress to the point of being unbearable, it'll be too late to go back. Change your diet. It doesn't have to be as extreme as never eating meat again or going vegetarian. Start with portions. Try eating more grains like rice or pasta than you eat meat. From there, drop the pasta and add in more vegetables. If you want to eat dessert, swap that out with some good and well-prepared fruit. Even strawberries with a little whipped cream or cream cheese would be a healthier pairing than a big German chocolate cake. Get out and exercise. We say this one a lot, but it's important to get your blood pumping and moving throughout your body easier. Why? Because your blood carries your oxygen to the parts of your body that need it. Even if it's doing standing squats in front of the TV or walking to the mailbox, start small and build up from there. If you can keep yourself disciplined and consistent in your goals, you'll be walking marathons in no time. How long can you live with interstitial lung disease? The condition, which is a part of a group of disorders known collectively as interstitial lung disease, causes inflammation and scarring of your lung tissue, and sufferers have an average life expectancy of between just 3 and 5 years. What are the signs of the end stages of interstitial lung disease? A troublesome cough, poor appetite, chest pain, disturbed sleep patterns, frequent hospital admissions, or needing intensive home support due to regular flare-ups, finding it difficult to maintain a healthy body weight, feeling more anxious and depressed, and fatigue.